Here's a demonstration of how I would use muscle scraping for a sprained ankle. First, you need to go over the most commonly injured part of the sprained ankle. It's called your ATFL, anterior talofibular ligament. It basically runs from your distal fibula to the talus. Very complex name. This is a very poor drawing, but it goes from there to there. When you get an inversion sprain, most people roll their foot inwards and they roll like that. That will tear that ligament or severely strain it. The most overlooked thing with that is when you do that inversion sprain, everybody's looking, did you tear or sprain that ligament? And a lot of times the answer is yes, but what also happens is when you get an inversion sprain, these muscles on the outside of your leg, they're called your peroneals, will get strained as well. When your body feels that that ankle is starting to roll in, it thinks, oh shit, we need to stop that. These muscles right here that control your foot going out into eversion will contract or pull like hell to try to keep your foot from rolling inwards. When they do that, they get strained as well. Those muscles, there's a whole bunch of them. If you're curious, Google it. They run all the way down. Even one of them runs all the way to the bottom of the foot. Meanwhile, with an injury like that, everybody wants to focus in on the lower part of the ankle, where you can see that the injury happened. The one thing that gets overlooked is the soft tissue injury that you most likely also had, here down through the peroneals. So that's where I'm going to demonstrate how I would use a muscle scraping tool to help not only the peroneals that are injured, but also the ligament as well. So I've already applied some coconut oil to the muscles itself. Right here down the top, we have the tibia. It's very hard, and then on the outside we have the fibula. I am going to go right in between those two. It's nice and squishy. Sometimes you'll have tender points. I'm not going to do the bone. So I'm going to take my tool and I'm going to go in the direction of those muscle fibers. I can go from close to far away, or I can even go from far away to close. Whatever's easiest is what I will generally do. There are situations where you will find that one direction is more sore or tender than the other. I'm trying to long sit or partially long sit for you all so you can see, but one of the easier ways to do it is have your knee bent up and then you can use both hands. It's harder for you to see what you're doing, but you can still feel what you're doing. I'm still shooting for those muscles right there, the peroneals, anterior tibialis. Anterior tib is the one that pulls your foot up. The peroneals are more the everters to take your foot out. I'm going to spend 3 or 4 minutes doing this. I may get some 𝗘𝗘𝗏𝗖𝗟𝗔𝗟, some 𝗘𝗏, as they call it in the Chinese medicine, fancy name for a hickey, or I may not. If I find an area that is more tender than the others, I will spend more time there. That tells me that that area is congested, it's inflamed, and it needs a little bit more concentration with the tool. The most common areas that you will see the 𝗘𝗏 or 𝗘𝗘𝗏𝗏𝗏 are going to be right up top here, where a lot of the peroneal muscles start, and then the head of your anterior tib, a dorsiflexor, is at as well. This is a common spot, and then even down in here where these muscles, you have the main muscle bellies, and then it starts to come down and they turn into the tendons that go down into the foot. That is another common area. Folks that feel a lot of pressure or tension on the front of their joint, of their ankle joint, they feel when they pull their foot up that it just feels bound up. Even working this area right in here will free that up a lot of the times. Because if these muscles can breathe better and they're looser, then this will breathe better and feel more mobile. I can use a one-handed technique, going from close to far, one-handed technique coming from far to close. I could use a two-handed technique, so that way my hands have to use less pressure. Nice smooth motion. And as I've gradually worked deeper, because I started off light, going through layer 1, I've let that warm up, and then now I'm starting to use more pressure. As I went through layer 1, I really didn't feel much. As I'm going through layer 2, I can feel right through here. That is likely going to be some of that anterior tib and also part of those peroneal muscles. So it's right there at that junction where they go from muscle belly, pure muscle, to start turning into tendons. You can even hear the crunch in there. The crunch may be from soft tissue adhesions. It may just be from my anatomy. I honestly don't care. I'm gonna get you guys another view. So here's another view from up top. I got my bar pointed at about a 45-degree angle, and you can see the 𝗗𝗘 or the 𝗘𝗘𝗏𝗖𝗔𝗟 starting to really show up there. So here's tibia, bone, anterior tib, and then over to the side, peroneals. If I hit that tibia, not the end of the world, it's just not that comfortable. And then now I would say that's pretty good. And the next, I'm gonna do right here, where that ligament would be. So that ligament would roughly be right through here, lateral malleolus of my distal fibula, and it runs this way. There are muscles, tendons, ligaments, nerves, arteries, and veins in there. They all need blood flow. Area like this, I'll probably work for 2 to 3 minutes. You can see I have a scar right here that is from an old surgery where I fractured my ankle. This is something that I will do to this leg and ankle probably once every few months, depending on how active I am. There are some situations where you want to purely try and cure something. This is not one. I cannot. The integrity of this joint has been disrupted because of the surgeries and the fractures. This is something I'm gonna have to deal with for the rest of my life. Using this tool helps loosen the scar tissue up, loosens the muscles up, increases blood flow, and allows me to do the things that I wanna do. You can see the 𝗗𝗘 real nice there, the 𝗘𝗘𝗏𝗖𝗟𝗔𝗜𝗍. There you guys go. There's what I do for my chronic ankle issues. Mine was a fracture, 2 surgeries, but this is also very applicable to anybody who's had an ankle sprain, whether fresh or chronic. Always check with your provider. But one of the biggies that gets missed is that soft tissue work for the ankle peroneal muscles on the side that evert your foot, and ankle dorsiflexors that pull your foot up. If you guys have any requests of anything to be seen that could be used for a muscle scraper, post it. Let me know. Now that I'm sweating my ass off, I'm done.